Welcome, NUR 300, Nursing in the Contemporary U.S. Healthcare System. I am your professor, Dr. Marion Johnson, and I will be guiding you through the next 6 weeks of Nursing 300. Week by week, we will enter into lectures, PowerPoint presentations. We also have weekly activities, i.e. this week we have several YouTube lectures on Affordable Health Care Act to guide you through this week's discussion. Also a brief chance for you to discuss with each other a little bit about yourself. Everything looks good so far. Sorry about the time frame for the lecture, but we'll get there. We'll get it done. So this week we're going to review the development of nursing over time. A brief look at the evolution of professional nursing. Throughout the pages of recorded history, nurses has been integrated into every facet of life. A legacy of human caring was initiated when, according to the book of Exodus, two midwives, Shiphrah and Puah, please forgive my way of saying them. They could be different. They rescued the baby Moses and hid him to save his life. So this legacy of caring has progressed throughout the years, responding to physiological, social, environmental, and psychological needs to society. Nurses of the past and present have struggled for recognition as knowledgeable professionals. The evolution of this struggle is reflected in political, cultural, environmental, and economic events that have sculpted our nation and world history. So, traditionally, society recognized men as healers, and women challenged the status quo and transformed nursing from a mystical phenomenon to a respected profession. Florence Nightingale, she played a major role in bringing about changes in nursing using the concept of role modeling. She and other nursing leaders demonstrated the value of their worth through their work in fighting the cause of health and healing. During the 20th century, nurses made tremendous advancements in the areas of education, practice, research, and technology. Nursing as a science progressed through education, clinical practice, development of theory, and rigorous research. Today, nurses continue to challenge to expand their roles and explore new areas of practice and leadership. This chapter provides a brief glimpse of healthcare practices and nursing care in the prehistoric period and early civilization, and then describes the evolution of professional nursing practice. Nursing is a dynamic profession that has evolved into a theory, research, and evidence-based practice. From its unorganized and variable defined beginnings, a profession based on framework of competence, autonomy, determination, and human caring has developed. The challenges and opportunities have paralleled the path of world history and have brought about significant changes in the profession. From the men who opened the path to the women who brought dignity and respect to their philosophy of caring, to the pioneers who brought unity to a profession plagued by a history of racism, sexism, and sometimes disgrace. Nursing has become recognized as critical to the health of the nation. Despite myriad challenges, the practice of nursing has been distinguished and qualified by intellect, skill, commitment, and contribution of countless nuns, deacons, and individuals such as the Dix, the Barton, the Wald, Breckenridge, and Nightingale. The nursing profession has the capacity to effect far-reaching changes in the healthcare system. Close proximity to patients and scientific understanding of care across the healthcare continuum, from health promotion to disease prevention to coordination of caregiving, nurses, the unique ability to lead in the improvement and redesign of the healthcare system. Research has linked nursing care to the safety of patients. Nurses will continue to increase knowledge, manage technology, and maintain ethical standards to provide high quality, patient-centered, safe care to individuals, families, communities, and populations throughout the world. Nurses are crucial in preventing medication errors, crucial, reducing infection rates, and facilitating patients' transition from hospital to home. Significant nursing contributions to the creation of a quality, patient-centered healthcare system that is accessible, equitable, evidence-based, and sustainable will require transforming the work environment, scope of practice, education, and number of nurses in the United States. Through periods of war, socioeconomic change, and healthcare reform, nurses have played a vital role in initiating change to improve the healthcare arena. Nurses have provided the integrity to maintain the quality of care in all healthcare settings. The evolution of practice from the treatment of disease to health promotion and disease prevention has led the way in determining the type of providers needed to care for patients in the future. This evolution will continue to provide the foundation for the scope of practice, educational curricula, scholarship, and research necessary for the nurses to lead and manage the healthcare environment of the future. Nursing in the 21st century. It is frequently claimed that nursing is vital to the safe provision of healthcare and health service to our populations. It is also recognized, however, that nursing is a costly healthcare resource, and it must be used effectively and efficiently. Therefore, there is growing recognition from within the nursing profession, as well as by healthcare policymakers and society, of the need to analyze the contribution of nursing to healthcare and its costs. This issue becomes increasingly important in an era of staff cuts and staffing deficits, combined with higher patient expectation, escalating healthcare costs, and a healthcare system restructuring and reform agenda. Such factors make the identification and effective use of the nursing contribution to the healthcare an issue of critical importance. Professional nurses in the 21st century are faced with many challenges with the dynamic state of healthcare. In addition to the issues of access, cost, quality, safety, and accountability in the healthcare, nurses today are challenged by an aging population, a serious nursing shortage, generational differences in an Asian workforce with poor prospects for replacement, high acuity and short staffing, conflict in the workplace, expanding technology, complex consumer health values, and an increasingly intercultural society. Nurses have identified numerous areas of concern, including insufficient staffing, inadequate salaries. That in turn affects effects of stress and overwork, violence in the workplace, and lack of participation in decision making, and dissatisfaction with the quality of their own nursing care. Changing duties, responsibilities, and conflicts amid nursing shortages and public concern over patient safety and quality of care characterize present-day practice. These changes require professional nurses to have core competency in critical thinking, communication, interprofessional collaboration, assessment, leadership, technical skills, in addition to knowledge of health promotion and disease prevention, information technology, health systems, and public policy. In 2008, the Robert Wood Johnson Foundation, RWJF, proposed a partnership with the IOM to assess and respond to the need to transform the nursing profession. The WJF and the IOM established a 2-year initiative on the future of nursing. The IOM report released in 2011 had the following 4 key messages. Nurses should practice to the full extent of their education and training. Nurses should achieve higher levels of education and training through an improved education system that promotes seamless academic progression. Nurses should be full partners with physicians and other healthcare professionals in redesigning healthcare in the United States, and effective workforce planning and policy making require better data collection and an improved information infrastructure. These recommendations focus on the intersection between the healthcare needs of diverse populations across the lifespan and the actions of the nursing workforce. In 2010, Congress passed and President Barack Obama signed into law comprehensive health legislation. These laws, the Patient Protection and Affordable Care Act and the Health Care and Education Affordability Reconciliation Act, are collectively referred to as the Affordable Care Act. Thank goodness, the ACA. That's what we're going to use from here on out, the ACA. So the ACA represents the broadest changes to the healthcare system since the creation of Medicare and Medicare programs in 1965. The ACA is expected to provide insurance coverage for 32 million previously uninsured Americans. 32 million. That should be a test question. The new demand on the healthcare system has significant implications for nursing. The nation's largest healthcare profession, with more than 3 million RNs nationwide, nurses have the potential to effect significant changes in the healthcare system that will meet the demand for safe, quality, patient-centered, accessible, and affordable care. The U.S. is projected to experience a shortage of registered nurses that is expected to intensify as baby boomers age and the need for health care grows. The need to intensify as the baby boomers age and the need for health care grows. Yes. So compounding the problem is the fact that nursing schools across the country are struggling to expand capacity to meet the rising demand for care. Given the national move towards healthcare reform, high nurse retirement and turnover rates are affecting access to healthcare. A 2015 study has found that almost 40% of registered nurses are over the age of 50. 40% over the age of 50. The number of nurses leaving the workforce each year has grown steadily from around 40,000 in 2010 to an expected nearly 80,000 by 2020. Meanwhile, the study observed the dramatic growth in nursing school enrollment since 2000 has begun to level off. Not good. A wave in faculty retirements is expected across the United States over the next decade. Master's and doctoral programs in nursing are not producing a large enough pool of potential nurse educators to meet the high demand. Higher compensation in clinical and private sector settings is luring current and potential nurse educators away from teaching. According to the American Academy of Nurse Practitioners, the average salary of a nurse practitioner across settings and specialties was $97,083 in 2015. By contrast, the AACN reported in March 2016 that a master's prepared facility earned an annual salary of $77,022. $20,000 difference. March 2016 marked the release of the report Advancing Healthcare Transformation, a new era for academic nursing, commissioned by the AACN. And this report calls for enhanced partnerships to advance integrated systems of healthcare, achieve improved health outcomes, and foster new models of innovation. Images of nursing. When you imagine a nurse, what mental picture comes to mind? Do you think of Life magazine's 1942 cover picture of a nurse in a starched white uniform with a cap on? The nurses portrayed in Johnson & Johnson's campaign for Nurses Future, or your colleagues with whom you practiced yesterday? All of them are architects of healing. The contemporary image of professional nursing in the United States is an ever-changing kaleidoscope created by 4.73 million men and women of all ages, races, and religious beliefs who have active licensure as registered nurses. The National Council of State Board of Nursing. Adding to this multifaceted collage are the numerous snapshots of nurses and nurses as portrayed in television commercials, bumper stickers, art, poetry, architecture, postage stamps, television dramas, television series, movie, newspaper, comic strips, stained glass windows, and statues. Nurses whose profession is second in size to that of teaching have been alternatively described as either saints or sinners, powerless or powerful, admired or ignored, and those who dare to care. Their practice has captured the attention of historians, economists, sociologists who have studied this unusual group of people. To whatever your image of nursing is, first add the many heroic nurses who have served in Afghanistan and Iraq, and in every U.S. war. In July 1775, after the United States established the Continental Army, General George Washington requested the Second Continental Congress to provide one nurse for every 10 patients and one matron for every 100 patients to supervise the care of wounded and sick soldiers. His confidence was very well placed. Registered nurse supply. In all my lectures, we talk about the color of my water bottle, extra points on your test if you know the color. Fear not, yes we do have test questions. Okay, how are we for time? . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . . That's my cat meowing. Hang tight. Okay. Registered nurse supply. The United States averted a projected 20% shortfall, 400,000 RNs in 2020 because of the importance of nurses in healthcare. A combination of factors forestalled the 2020 national shortfall. The combined effects of the Johnson & Johnson campaign for nursing, followed closely by the Foundation initiatives and the Institute of Medicine, the IOM, Future of Nursing report changed the image of nursing for both millennials entering college and the public. Underscoring these events were the unprecedented job losses, 8.8 million of the Great Recession, 2007 to 2009, that happened in other fields as nursing saw record increases in new job growth. RN graduates increased by more than 222% between 2002, 70,692, and 2016. So 222% between 2002 and 2016. So 70,692 in 2002 and 157,073 in 2016. 222% increase. I think I got that right. Yes. However, the greatest growth between 2002 and 2012, with annual increases of 7% in the National Council Licensure Examination for RN, the NCLEX RN, test takers for Associate in Science and Nursing, the ASN degrees, and of 8% in test takers in the BSN degrees, have leveled off to a 5% BSN annual increase and a 1% ASN increase. Modifying the new increases in the new nurses is projected retirement of 1/3 of the nursing workforce between 2017 and 2027. In part, this change will occur because almost 24% of registered nurses remained in the workforce full-time until age 69. 69. A trend was mirrored among men and other professions as well. Come on, guys. Bring a guy, bring another guy, bring 5 guys to every nursing school with you. Let's enroll these men. We need more men in the workforce. Come on. Later retirement ages have converted a gradual workforce loss over several years to larger losses at one time when the baby boomer majority reaches age 70. As Burhouse and colleagues noted in their review, the significant loss was 1/3 of the nursing workforce retires is not one of numbers because of growth increases, but rather a loss of experience and know-how. Nursing has lost 1.7 million experience years to retirement in 2015 and will lose an additional 2 million experience years in 2020. That's a lot. Although it is important to know why an unprecedented nursing shortage was averted, the crucial issue is how was it reversed? Multiple legislative efforts began with the 2002 Nurse Reinvestment Act, which provided nursing scholarships, public service announcements promoting nursing as a career, faculty loan cancellation programs, geriatric training grants, and nurse retention and safety enhancement grants. The image of nursing as a job growth profession continues with an expected new job growth rate from 2016 to 2026 of 15%, or twice the average of all occupations, 7%. Social media in nursing. Nurses portray Nurses portray nursing through their social media platform, Facebook, Snapchat, Instagram, Twitter. Although it provides asynchronous communication among communication medium among friends, the connection offered by friending or following on such platforms is often extended to unknown persons. Nurses and student nurses who have self-identified as nurses or students have posted comments about their practices, managers, or patients, whether named or not, creating serious professional issues for nursing. 33 State Board of Nursing, SBNs, reported receiving complaints about nurses using social media, and 26 of these SBNs reported having disciplined the licenses of nurses. Nursing students have been expelled from nursing programs because of both positive and negative online postings about patients. The courts have upheld those decisions because of the significant breach of professional boundaries such postings make. Regrettably, nurses have friended patients and their families, leading to significant professional concerns about maintaining professional boundaries. The widespread use of candid cell phone camera pictures and video clips produces images amusing to friends, but not as amusing to the human resource professional hiring nurses, to the managers, or to the courtroom when an error with serious consequences brings the nurse's professional judgment into question. Nurses have been terminated from positions and had their licenses disciplined or removed because they have posted pictures of patients on social media sites. They have been similarly disciplined for receiving patient pictures and not immediately reporting the problem. Removing a posting or a picture from a website does not make it unavailable because it remains retrievable. Nurses can positively use electronic social media to share workplace concerns or events that are emotionally charged for support and guidance, but they must always be mindful of not providing names, explicit details, or patient identifiers, including photographs, to protect patient and nurse privacy. Nursing's response. Nursing students are the future of nursing. Taking this responsibility seriously, students begin two similar programs directed towards the image of nursing. The National Student Nurses Association, NSNA, Image of Nursing 1993 program, and the Johns Hopkins Center for Nursing Advocacy, which has been rebranded as truthaboutnursing.org. With the theme of Healthy Nurse, Healthy Patient, NSNA annually awards outstanding image of nursing projects and provides information to students. An important part of the program is the media surveillance information furnished to students. How to contact the television networks, how to most effectively transmit information to them, and sample letters are offered to enable student voices to be heard when there is a negative nursing media or advertisements. NSNA has adopted a policy on social media that includes important examples of boundary violations. In April 2001, 7 graduate students at the Johns Hopkins University School of Nursing founded the Center for Nursing Advocacy, which in 2008 became Truth About Nursing. It was designed to challenge stereotypes and to monitor and positively influence the portrayal of nurses in all media venues. The organization successfully changed many negative nursing images. The Institute of Medicine's Future of Nursing. In 2010, the Institute of Medicine, the IOM, issued a landmark report, The Future of Nursing, that has significantly affected the image and the future of nursing. This report included 4 main recommendations. Higher levels of nursing education, 80% BSNs by 2020, and doubling the number of doctorates through seamless academic progression. Removal of barriers to enable nurses to perform to their full scope of practice based on their educational preparation. Use that knowledge. You've been given it. Inclusion of nurses as full partners with physicians and other professionals in redesigning the healthcare system in the United States. Improve data collection and information infrastructure to facilitate more effective workforce planning and information infrastructure. The IOM also recommended nurse residency programs that would be funded through redirection by the Secretary of Health and Human Services of all graduate medical education funds from diploma schools to residency programs in rural and critical access areas. A change in accreditation standards to require an assessment of clinical competency and seamless access to higher levels of nursing education that expands beyond an articulation agreement, inspiring that nurses engage in lifelong learning and prepare and enable nurses to lead change to advance health. The reality of the contemporary staff nurse. The reason for the existence of the modern healthcare institution, the hospital, the nursing home, the mental hospital, the home care agency, is to deliver nursing. If surgery could be done safely and economically on the kitchen table, and if people could survive it, it would be. If diagnoses and management of serious medical illnesses could be done in office practices in 8.5-minute visits, it would be. If the chronically mentally ill could be taken care of at home and protected from the world and from themselves, they would be. If the demented, the frail, the paralyzed, the very old could be cared for at home, they would be, and it would be a whole lot cheaper because public policy would not contemplate channeling the money to family caregivers. They're supposed to want to do it anyway. Logically, it could be inferred that nurses' satisfaction with the work settings should be high because their practice settings exist to deliver their services, and new practice settings are emerging daily. The public highly values their profession. The last national sample survey of registered nurses, the NSSR, found that 79.8% of practicing RNs were satisfied with their job and 88.4% with the same employer in the preceding year. The look of nursing. Somewhere between the gleaming white uniform, hose, shoes, and cap of the past, and the Mickey Mouse t-shirts, wrinkled scrubs, tattoos, and nose rings often seen today, which seem better for going to a come-as-you-are party than a professional image for nurses. Fogel and Ream suggest that nursing attire is now directed more toward reflecting the nurse's individual preferences than projecting a professional image. Nurses are realizing that the grunge look encourages no one to take them seriously and are finding more appropriate ways to express their individuality. The work of attire of any professional says to the world how significant the task at hand is to that professional. The wrinkled, mismatched scrubs or tank top over tank top look is far more appropriate for gardening than the knowledge work of nursing. When some nurses and nursing students design and wear t-shirts that are sexually demeaning to the profession and to themselves, economic demand and economic support are provided to companies to demean the profession. We all must find a better way to express humor. More recently, the nursing attire of hospital nurses has become an issue of safety for two important reasons. Patients and families have expressed their concerns about being unable to identify who the nurse in the hospital is. When time may be a critical factor, Patients and/or family members may relay critical information about a patient's condition to a housekeeper, believing that person to be a knowledgeable nurse, or may waste valuable time asking multiple people where they are, where is the nurse. The second safety issue is found in the impossible transmission of infectious organisms via nursing clothing that is worn in public places. The influence of contemporary trends and issues on nursing education. New nursing programs, courses, and experiences, as well as changing requirements for the development of critical skills and critical thinking, pave the way for different opportunities for the students to prepare for the initial and continuing nursing practice in a rapidly changing society amidst a rapidly changing healthcare delivery system. These trends influence the number and the types of nursing programs for basic and experienced students at the undergraduate and graduate levels. In this chapter, essential differences among basic educational programs, innovations in new degree programs, majors and courses, and mobility and distant learning programs are reviewed in context of changes in the national organizations and accrediting and regulatory bodies. Students who study and comprehend these trends are better prepared to cope with rapidly changing nursing education models and healthcare systems. It is critical that nursing students at all levels stay abreast of changes in nursing education and the healthcare landscape so that they may become competent healthcare practitioners and can meet the complex needs of patients from diverse multicultural and demographic backgrounds. Trends and issues in contemporary nursing education. Knowledge expansion and use of technology and the internet. With ever-expanding developments in electronic information and communication technology, the volume of information is growing exponentially on a global level. Nurses have been interacting with technology for decades. In 1994, the ANA, the American Nurses Association, I won't say that again, the ANA, published Nursing Informatics Standards, understanding that nurses interact with technology at high rates. Informatics has become a major part of education and practice and is part of the American Association for College of Nursing, the AACN. Essential for all levels of nursing education. The ability to create, access, and disseminate unlimited information rapidly has enormous benefits. Individuals from across the globe use various forms of social media, including blogs, Twitter, Facebook, YouTube, and LinkedIn. Millennials grew up using technology and are the main generation in many undergraduate nursing programs. Nursing educators must be sensitive to the learning needs of their students and incorporate innovative technologies into learning. Use of social media has become so common in nursing that guidelines and code of ethics statements for it have been developed by employers and by the national nursing organizations. The use of social media has become a concern for nurses, nursing students, and educators. Using digital forums to communicate requires an understanding of policy and potential legal implications because few understand the implications and health systems lack policies for its use. Websites allow for rapid access to online and printed material. Digital health-related materials can be updated quickly, allowing educators to create and revise online course content, assignments, and examinations. Nursing educators are using TED, technology, entertainment, and design. Talks to cover a variety of topics from science to global issues. Nursing is also engaged in various technologies that impact care. For example, nurses are now challenged with having an understanding of genetics and genomics, digital diagnostics and treatments, robotics, biometrics, and electronic health records. Using computerized testing prepares students for computerized licensure examinations. A study conducted by Broderson and Mills found that using the RN Comprehensive Predictor Examination, or exit evaluation at the end of a basic RN program predicts a student's success on the National Council Licensure Examination for Registered Nurses, the NCLEX RN. Information technology and computer use have become larger parts of patient care and nursing workflow process, but do not take away from direct patient care and allow nurses to access and analyze information. Further, the Healthcare Information and Management Systems Society, HIMSS, identified that nurses at all levels of education need health informatics competencies. Excuse me. Increasingly versatile smartphones help students, faculty, and nurses access valuable current information to manage complex patient data and thus reduce emotional stress and error. That came from Farrell, 2016. And please, guys, cite your sources when you're doing your weekly discussions. You need to cite sources. Yes, we're in the BSN program now. We cite our sources. Furthermore, smartphone usage in acute care settings quickly connects the nurse with the provider, allowing critical information to be sent from patient care needs to be expeditiously addressed. Nurses receive and retrieve real-time patient data using model devices and can access evidence-based resources at the point of care that lead to improved quality and outcomes. Exposure to digital resources on mobile devices introduced early into the nursing curriculum and embedded throughout the program is effective. With almost unlimited information available, students may actually take more time to navigate online resources than traditional print-based resources and may become overly engaged in following links, network, and using chat rooms. Faculty and students need to work together to promote efficient and effective use of electronic learning tools and networking. Reducing overload and frustration requires disciplined focus and clear guidelines and outcomes. Learning from online resources can help students develop skills in analytical thinking, decision-making, and reflective judgment, and are essential for selecting valid and reliable sources. These are difficult, but essential for competencies for evidence-based practice. The use of blogs have been cited as a method to increase communication among nursing students and a forum to share medical information. Performance-based learning and assessment. Okay, so trends related to learning and evaluation. Trends related to learning and evaluation methods are changing fundamentally, owing in part to changing technology and the greater focus on patient safety. The emphasis on competency outcomes and criteria for acceptable practice has promoted leaders in the nursing education to promote innovative programs and learning methods, as well as more interactivity and engagement interspersed with lectures. Passively listening, reading, and passing written tests do not necessarily promote competence in the core performance skills expected in practice. Increased emphasis on critical thinking and learning to integrate principles is more effective than trying to remember all the content, which often leads students to just want to pass the test. Competency-based learning creates an atmosphere that is focused on learning concepts and encourages collaboration between teacher and learner to achieve actual practice competencies. Practice-based competence uses terms like interactive learning, collaborative learning, and competency-based learning. This trend requires changes in the roles of teachers and students. The teacher is less a lecturer and more a facilitator and coach, providing direction for learning stated outcomes. The student is more actively accountable and responsible for achieving competence in designated knowledge and practice skills. In this new paradigm, instructors focus on the most essential content. Excuse me. Let me take some water from my pink water bottle. So everybody that's watching, my pink water bottle. And if you do watch, first one to post gets a prize. First one to post in the forum what color my water bottle is. Prize time. Point time, I should say. Because this is long. These are long lectures. I love it, but they're long. So, nurse and faculty provide feedback and validation that cannot be gained through books or the internet. Memorization of basic facts is still important, but is insufficient when nursing practice emphasizes such skills as assessment, critical thinking, communication, patient teaching, and caring and advocating for patients. The focus on practice competence helps students learn how to access and integrate ever-changing information as required in actual practice, rather than trying to remember all the content. The move toward total adoption of competency-based nursing education is slow in part because of students' criticism that this model is expensive and requires active independent learning, and faculty reports of increased workload and lack of metacognitive learning and critical thinking. Many colleges and universities have adopted a hybrid model of traditional teaching and learning pedagogies with some competency-based evaluations. A trend in many nursing programs is the development and incorporation of evidence-based practice. EBP, my favorite word. There's another question. What's my favorite word? Evidence-based practice. Courses, in addition to traditional nursing research courses. Learning about EBP includes evaluation and translation of evidence into practice. The Academic Center for Evidence-Based Practice, ACE, at the University of Texas, San Antonio, which was developed as a center for excellence, provides up-to-date information about evidence-based practice. In 1997, the Agency for Healthcare Research and Quality, AHRQ, please download this so that you get notifications from the AHRQ on a daily basis. Great resource. Promise. The Agency for Healthcare Research and Quality, AHRQ, developed an evidence-based practice center program. You'll also find some grants in there. Yes, big money. Simulation in various forms is another major performance-based learning strategy. Shadow health, vSim are technologies that use digital patient simulation to teach critical thinking. Shadow health offers digital clinical experiences such as concept labs, immersive tutorials that illustrate complex nursing subjects. Concept labs include examples of real body sounds and realistic three-dimensional anatomic body modules to compare and contrast normal and abnormal findings. The interactive interfaces of these concept labs can be used to explore body systems at an in-depth level. These experiments make classroom concepts come to life. Designed to simulate real nursing scenarios, simulations allow students to interact with patients in a safe, realistic environment anytime and anywhere. This technology enables students to develop critical clinical reasoning skills, competence, and confidence in nursing. Mannequins have become more essential and incorporate sophisticated computerization to promote more realistic learning and critical thinking. Another form of simulation is the use of standardized patients and telemedicine technology to achieve outcomes. The use of standardized patients has the ability to bring emotions to simulation. A systematic review found the objective structured clinical examinations, the OSCE, to be the most valid assessment measurement in use. The use of standardized patients as a competency-based summative assessment allows faculty to assess mastery of entry-level clinical skills, some of which the students may not have access to in the clinical setting. Other interactive learning strategies include portfolio learning and peer-to-peer learning. Interactive strategies are more important than the location of the clinical. Interactive strategies are more important when the location of the clinical learning is considered. More and more diverse settings are used because there are places where nurses' expertise is needed. In addition to hospitals and extended care facilities, clinical learning often takes place in alternative settings, such as nurse-run clinics in schools, daycares, and senior centers, and even prisons. Over the last decade, service learning projects have also helped students learn actual practice skills throughout the community. Another form is faith-based learning projects that put nurses in churches and congregations. Many interactive clinical-related learning strategies and more traditional clinical assignments increasingly engage practicing nurses as preceptors. The change to competency outcomes and practice-based learning requires changes in evaluation methods that focus on valid, actual performance of required competency in realistic scenarios. Paper and pencil tests and inconsistent subjective clinical observations by instructors or preceptors are not adequate. Structured, objective validation of competence requires performance examinations that specify the core skills and related elements, the application of mandatory principles that must be met according to the established practice standards. In addition to performance of nursing skills, structured portfolios are used to document other competencies. Community-focused interprofessional approaches. The societal trends described here, along with the large-scale economic and political influences to reduce healthcare costs, may indirectly promote prevention and interprofessional initiatives. Many lay and professional health conscious groups are working to change the national orientation from illness care to more efficient and effective health care. Another contributing factor is the growing emphasis on health of the family as a whole and on entire communities and populations. Healthy People 2020 has expanded on Healthy People 2010. With the current mission cited to identify healthcare initiatives, increase awareness of health, identify measurable objectives and outcomes, improve practice through evidence, and identify research, evaluation, and data collection methods. As more citizens live longer and develop acute and chronic illnesses that can lead to disabilities, nurses work in a widening range of settings: acute care facilities, ambulatory clinics, nursing homes, hospices, home care, assisted living facilities, faith-based initiatives, and alternative integrative healthcare practices. Regardless of the setting, community healthcare involves an interprofessional team that is often coordinated by nurses. Nursing students are positioned to learn from and work with practicing nurses who function in diverse roles to understand the scope and the role of a nurse and to begin to identify an area of nursing interest. Therefore, the concept of community care agencies has changed. Hospitals are only one of many community health care resources, along with wellness and senior centers. The changes in the healthcare landscape with a focus on preventative care and community care require a different philosophy of care and competencies that emphasize interprofessional and interagency collaboration. The rapidly changing and expanding healthcare culture incorporates concepts of shared responsibility for health promotion among individuals, families, community, and multiple care providers. Nursing education is influenced by these trends to promote family and community health and healthy lifestyles, as well as increase interprofessional learning and collaboration. In response to a paradigm shift to interprofessional care and the provision of care following the IOM's 6 aims of improvement: safe, effective, patient-centered, timely, efficient, and equitable, AACN developed core competencies for interprofessional collaborative practice. According to the AACN 2011 report, changes needed in a way healthcare professionals are trained, increasing didactic and clinical interprofessional collaboration. The 4 competency domains identified as values, ethics for professional practice, roles, responsibilities, interprofessional communication, and teams and teamwork. Although interprofessional educational experiences are encouraged for all healthcare disciplines, DeLunis and Rousset, correct me if I'm wrong, cite the importance of preparation of students for interprofessional educational experiences and for the need for regular meetings when students are engaged in learning as members of a healthcare team. I'm going to talk about patient-centered care, engagement, safety, and privacy. As patients have become more knowledgeable about illness care, health promotion, and the consequences of errors in care, have become more assertive about their right to competent care and privacy of information. The 2002 Health Insurance Portability Accountability Act, HIPAA, mandates protection of an individual's privacy by healthcare providers and throughout society has changed many previously careless and harmful practices. The economics and politics of healthcare and access to comprehensive information via the internet have prompted more consumer activism through advocacy groups and internet connections to influence healthcare policy and standards. Patients use internet resources sponsored by the government and private entities to become more informed about illness and healthcare. As informed and engaged patients, they are better able to make effective decisions in collaboration with healthcare providers. This development makes critical thinking, communication, and teaching essential nursing competencies. It also means that student nurses need to change their approach from giving patient care to working with the patient and family. As members of the healthcare team, Another issue affecting nursing education is the increasing number and consequences of serious medical errors. As reported in the IOM study to error is human, building a safer health system. These errors have led to an astonishing number of deaths and an increased number of expensive lawsuits, which further raise the cost of health care and tarnish the belief in the quality of available health care. Nursing faculty, administrators, regulators, therefore, are increasingly concerned with ensuring the competence of students and nurses. Medical error issues have precipitated increased requirements for competency-based education and performance assessments in schools of nursing and other health disciplines, in annual employment evaluations, and in agency accreditation criteria, all for patient safety. Something near and dear to my heart: shortage of nurses and faculty. The nursing workforce shortage has challenges: aging of the baby boomers, shortage and uneven distribution of physicians, accelerated rate of nurse retirements, and uncertainty of healthcare reform. Burhouse and Urbach observed that during the 2008 recession, nurses older than 50 years re-entered the hospital workforce. These writers assert that when this older hospital workforce retires, a hospital nursing shortage will reemerge without a doubt. The nursing workforce is more than 90% female, 80% white, and 47% prepared at a baccalaureate level. 64% employed in a hospital at rates at 64%, and 37% more than 50 years of age. The nursing workforce does not mirror the U.S. population seeking care in gender, ethnicity, or age. According to Burhouse and Urbach, one area the RN workforce has advanced is in the percentage who have baccalaureate degrees, which now exceeds that of those with associate degrees. The percentage who enter BSN programs is up. Yay! Job security. But not enough to meet the workforce demands. Students are assigned to multiple and diverse community clinical settings, some of which may be short-staffed, making it difficult for them to find qualified preceptors. Staff nurses who act as clinical instructors or preceptors may or not be prepared for those roles or have received adequate orientation. Students therefore need to learn to take more individual responsibility and initiative to gain essential core competencies. Online learning environments can be simulated to mimic real-world situations that allow for faculty to evaluate student learning from a distance. It comes from Phillips et al. Of 2010. New methods are created in partnerships with agencies to promote more effective clinical learning opportunities for students without overburdening staff. Flexible education, mobility, and distance learning programs. That's what we're going to talk about next. Various and non-traditional educational mobility programs now are commonplace. The AACN and the NLN websites attest to the growing number of programs that offer some form of flexible alternative program in addition to position statements on technology and nursing education, distant learning, and online programs. Distance or mobility programs include those for LPNs, LVNs to ADN, BSN, diploma and ADN graduates to BSN, MSN, and BSN to MSN, and doctoral programs. Let me know where you guys are going. I'll be there. Almost all use some form of internet-based courses, and some are entirely online. Some required periods of intensive on-campus classes or assigned clinical experiences with preceptors. Distance nursing education at all levels is another important trend to track. The most controversial but pace-setting distance learning program in nursing was developed under the New York Board of Regents as the External Degree Program. Initially named the NY Regents External Degree Program, NYREDP, it later was renamed Excelsior College. Who started in Excelsior? Anybody? I did. No structure, work on your own pace, very difficult, but doable, and great, all online. It later was renamed as Excelsior College. Its ADN program, initiated in 1972, and the BSN program in 1976, was fully accredited by the NLN shortly after. This innovative college provides quality degree programs in many disciplines for adult learners underserved by traditional programs by using assessment methods to document prior learning and theory and performance examinations to validate current knowledge and competence. The nursing program enrolls thousands of students and are accessible regardless of geographic location. The students are primarily LPNs or RNs, some of whom also have another degree or healthcare-related certificates. Over the years, many nursing programs have accepted and modified the distant learning and assessment approach originally developed by the NYREDP and continued as Excelsior College. The integration of electronic learning technology with assessment methods makes nursing degrees accessible to an increasing number of nurses seeking additional preparation. Career ladder programs designed as 1+1 or 2+2 option, which allows students to acquire 2 degrees at the same time, have been offered for many years by some schools and through several statewide programs. Multiple mobility programs are available for LPNs to obtain an ADN degree. Fortunately, an increasing number of registered nurses are recognizing the need to advance their education, and many employers are providing funding and support to facilitate academic progression. Enrollment in RN to BSN programs is increasing in response to calls for a more highly educated nursing workforce. From 2015 to 2016, enrollments in such programs increased by 1%, marking the 13th year of increase in RN to BSN programs. To accommodate the growing demand, the number of RN to BSN programs also has increased dramatically over the last decade. Currently, 747 RN to BSN programs available nationwide, including more than 600 programs that are offered at least partially online. 600. Program length varies to 1 to 2 years depending on the school's requirements, the program type, the student's previous academic achievement, changes in social, political, financial, and philosophic trends, the extensive use of communication and learning technology, verified success from past experiences, and the continuing shortage of nurses have combined to make educational mobility and distance learning opportunities a necessity and reality both nationally and internationally. Whereas the NLN continues to support all levels of education programs, the AACN and the other organization vigorously support the BSN for entry into practice and the professionalization of nursing. Read that again. The AACN and other organizations vigorously support the BSN for entry into practice and the professionalization of nursing. So, in October 2010, the IOM released the report, The Future of Nursing, Leading Change, Advancing Health, which provides a blueprint for transforming nursing profession. A key message of this IOM report was that nurses should achieve higher levels of education and training through an improved education system that promotes seamless academic progression. On December 18th, 2017, New York passed legislation that requires future RN graduates of an associate degree and diploma nursing programs to finish a baccalaureate completion program in nursing within 10 years after initial licensure in New York State. This legislation took effect immediately, and the requirement that nurses obtain a baccalaureate degree in nursing within 10 years of licensure will take effect in June 2020, only 30 months after the legislation became law. The escalating nursing shortage and the aging of the current nursing workforce and nurse educators have promoted more schools to offer flexible mobility options and types of programs. Some target potentially underrepresented groups, such as men, minority groups, and those with existing academic degrees. It is estimated that more than 58,000 nurses would be needed by 2018 to replace the aging workforce who will be retiring. The most rapidly growing are the accelerated, fast track, or second degree programs designed for non-nurses with other degrees. These programs are intended to try to meet the workforce need. In 2016, AACN reported the availability of 272 accelerated BSN programs and 69 accelerated master's programs available at nursing schools nationwide. For a list of accelerated programs, trends and issues that influence nursing education make it even more important to comply with quality standards that emphasize competency outcomes. Educational trends include changes in number, diversity, and qualifications of students, and shortage of faculty and finances make it necessary to develop more efficient and effective learning strategies for on-campus and distant students. Although mobility and electronic options are more convenient, they present issues. In addition to learning to access multiple digital resources, students also need discipline and determination to pursue courses in clinical learning when a teacher is not physically present or accessible. I'm not present, but I am accessible. Call me, text me, email me. I'm there. I'll even Zoomtown with you. You want to do FaceTime? You want to do Zoomtown? You got a question? We're there. You just have to utilize your resources. We need to upgrade contemporary nursing into a 9th edition because we are here. We are available. So regardless of the methods, anyway, sidebar, regardless of the methods, they must achieve required competencies in spite of other responsibilities and learn to integrate critical thinking, reflective judgment, and evidence-based practices in patient care. In contrast to previous decades, organizations and schools now require more creative, responsive programs and expect more documented competence from students and faculty. Nursing organizations set the standards and innovation that assist in the evolution of nursing education at all levels. Although these trends pose challenges for nursing students, faculties, and employers, they move nursing towards more competent professional practice and improve patient safety. We're going to talk about nursing and licensure certification. To practice nursing as a registered nurse, that is the goal of every student nurse. A goal achieved through study, clinical practice, and successful completion of the NCLEX RN. After licensure as RNs, nurses must still maintain and increase their knowledge and skills. Many nurses may wish to specialize in a particular area of nursing and expand their practice. Nurses with these goals may seek certification in a specialty field. I hope you do. This chapter describes certification, the means to achieve certification, and the organizations that administer certifying examinations. Whether it is licensure or certification, the nursing profession is constantly progressing. Legal requirements practice are continually being advised to ensure that the protection of the public. Throughout history and in the current healthcare environment, nurses face complex issues, new challenges as they seek to increase their competence and ensure the delivery of excellent nursing services to their patients. As nursing programs proliferated, variations developed among the programs. Entry criteria differed, and many educational programs were structured to meet specific employer needs. A simple registry of nurse graduates was no longer sufficient to ensure minimal levels of competency in all nurses. Regardless of the school in which the nurses were educated, another system was necessary to distinguish those sufficiently trained to provide nursing care from untrained or lesser trained individuals. Graduate nurses, physicians, and hospitals meet to resolve this confusion. The outcome was criteria for the licensure of nurses in the United States. Then as now, the primary purpose of licensure was protection of the public. Definition of nursing and scope of practice. In each state or jurisdictional Nurse Practice Act, the practice of professional nursing is defined. The definition of nursing is of the utmost importance because it delineates the scope of practice for nurses within the jurisdiction. That is, each act outlines the activities nurses may legally perform within a jurisdiction. Revision of Nurse Practice Acts. Nurse Practice Acts, just as other sections of states' codes, are written and passed by legislators. As in any legislative endeavor, many governmental agencies, administrators, consumers, and special interest groups seek to influence the legislation. These groups become actively involved in developing the accompanying rules and regulations. For example, physicians, dentists, pharmacists, licensed practical nurses, CNAs, emergency personnel, PAs are just a few of the healthcare providers directly affected by the scope and definition of nursing practice. Sunset legislation is one example of legislative activity affecting Nurse Practice Acts is sunset legislation. Sunset laws found in many states are intended to ensure that legislation is current and reflects the needs of the public. Purpose of certification. The purpose of advanced practice law is first and foremost protection of the public. Within the acts are definitions of advanced practice nursing. A number of states further differentiate the advanced practice of nursing by including separate titles for nurse practitioners, clinical nurse specialists. Current issues in certification. So despite tremendous strides in less than 40 years, certification processes for the advanced practice nurse continues to evolve. As with any new endeavor, advances are made in small steps and great leaps. Nurses in advanced practice face changing educational requirements for licensure and relicensure. Professional and legal issues regarding the scope of nursing practice and the independence of advanced practice nursing must change along with changes in healthcare environment. Theories of nursing practice. Nursing theory is defined as an abstract generalization that represents a systematic explanation about the relationships among phenomena. Theory development functions in a parallel manner to scientific process, although theory generally applies to a more specific area of the larger scientific process. Even though Sigmund Freud and Carl Jung each had their individual theories about the psychology of humans, their theories were focused on specific ideas taken from the entire knowledge base surrounding psychology and psychotherapy and its scientific premise. Similarly, Albert Einstein's theory of relativity was but a fraction of the existing scientific knowledge base of mathematics at that time. Nevertheless, it is an undisputed fact that these theorists changed the thinking of their time and were responsible for the evolution of the field of scientific interest and a of 1958. For a proposed theory to be accepted as a theory, it must meet the following six criteria: inclusiveness, consistency, accuracy, relevance, fruitfulness, and simplicity. Future of nursing theories and theorists. At no time in history have so many healthcare concerns been the primary focus of federal and state legislative agendas. New questions are being asked in the 21st century about how healthcare is being conducted and managed. It is imperative that nurses be on the front lines to provide testimony in response to these queries. The current nursing shortage, scarce resources, patient safety and medical errors, managed care, Medicare, welfare to work plans, confidentiality issues, parity of reimbursement, advanced practice nurses and their scope of practice, mandatory overtime, whistleblower protection, prescriptive authority, licensure, multi-state compacts, telemedicine, and many other policy issues that are directly affecting nursing practice are coming before the U.S. Congress and individual state legislative bodies for practice-related decisions. The direct effect on nursing cannot be overemphasized. As nursing continues to operate in an environment of ongoing change, outcome data will be analyzed in an effort to provide quality care and access to that care for all clients in need of healthcare services. Therefore, one may predict that established nursing theories will be reevaluated and modified accordingly. New theories will be created and developed that may help answer the healthcare questions of the 21st century. Simply put, nursing theories in the 21st century will embrace complex environmental changes that incorporate new technologies such as genetics, computers, non-invasive surgery, robotics, decrease in energy sources, increase in pollutants under a thinning ozone layer, environmental hazards, new diseases, and antibiotic-resistant illnesses. These changes have already resulted in client needs that differ from those as recent as 5 years ago. That concludes Week 1 lecture in Contemporary Nursing. I am your professor, Dr. Marion Johnson. I will see you in Week 2. Please call, text, email, any questions, any queries. Thank you, and you have a wonderful week. Don't forget your supplemental resources. Don't forget your instructor. Queries and questions. Use your forums. If you're thinking it, somebody else is thinking it. What color is my water bottle? What is my favorite word? See you all in Week 2. Have a great time.